This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss oral ketamine and home ketamine therapy using oral ketamine for depression as both maintenance therapy after IV ketamine infusions as well as initial treatment using oral ketamine. Now, ketamine therapy is available in a number of different forms and primarily as IV ketamine infusions where it's highly effective and rapid acting within days. Now, there are also tablets that are available, such as ready to dissolve tablets that are kind of a chalky consistency, as well as troches, which are basically a waxy type of a tablet that you put under your tongue, let it dissolve, hold it there about 10 minutes, and then swallow it or spit it out if you don't want the second journey. And then there's also nasal spray ketamine, available in a number of different percentages and concentrations. But ketamine infusions are more likely to produce remission of depression and depressive symptoms, while tablets and nasal spray produce relief of symptoms of depression, but generally not so much remission. Now, oral therapy can take several weeks for it to take effect in mood disorders. And just also remember that psychotherapy is still important because ketamine treatment can certainly fix up the neurocircuitry and it can help out with the mood or even put it in remission. But the behaviors that result from the mood, those are not affected by medications. Behavior is something that you need talk therapy or other types of therapy to kind of work through. Now, one thing that we notice with individuals with mood disorders as they're getting ketamine treatments is that they get sleep and anxiety problems. And some will feel more anxious during the initial treatment or have more insomnia during the initial treatment. And ketamine can certainly be anxiety provoking. It can cause a certain amount of insomnia as well. And that can kind of make the treatment plan a little bit more difficult. Likewise, for those doing IV ketamine as well as at home ketamine type treatments, they'll notice that, hey, when I use my ketamine in the afternoon, it keeps me up for a long time. And that's because ketamine can be a little bit activating. And there's some individuals where ketamine does make them sleepy, and so that's great. They can just use it at bedtime. But I just want to start off by discussing this midazolam-ketamine-ondansetron type melt that we formulate at the office and get it compounded. And it's different than the commercial type of MKO melt. This one has a different consistency to it. But effectively, you can put midazolam, which is like a Xanax Versed type medication, mixed up with ketamine and also ondansetron to kind of keep the nausea at bay. And this combination is great because for individuals that are starting to feel anxious because they are feeling more behaviorally activated as they improve from their ketamine infusions and they have more energy and more sense of reward, those individuals kind of have this feeling that they're anxious when in fact they just are starting to improve. But the other problem is that with IV ketamine and home ketamine use is that some individuals have trouble getting to sleep after they use the ketamine. So the midazolam can be combined with ketamine to allow the individual to actually get some rest and get relaxed in the evening hours. And they can use this in the evening to basically get their ketamine to allow neuroplasticity. And the dosing ketamine can be anywhere from 50 milligrams to 100 to 150 milligrams. And they can also get midazolam, which is like a Xanax type medication to basically allow them to relax and get a little bit of sleep. Now, the issue with this is you can't do it every night. It would be something to do on a periodic basis when you're really struggling. And this is something we see a lot of times in the initial infusion series. And so utilizing something like this can really be helpful for those individuals. And those types of melts, as they're compounded, kind of have this waxy consistency. You place it under your tongue, leave it there for about 10 minutes, and it just kind of dissolves and gets absorbed in the plexus under the tongue. And then you swallow the rest where it gets absorbed inside your stomach and small bowel. About 20% of it actually gets absorbed, but this is a great way to kind of augment individuals who are really feeling anxious and also having insomnia. Now, a little bit more about oral ketamine. It is certainly a very convenient treatment because you can do it at home, but oral ketamine has low absorption potential. About 20% of it's absorbed, and there are very few trials that really demonstrate efficacy over time. But it certainly can produce improved depression scoring and relief, but less so does it produce remission of depression. And it can really just kind of be used as a pick-me-up, where the individual is just needing some relief. But it's a short-sighted solution when it's used alone. And I feel that the IV ketamine, when it used initially, produces a higher chance of remission. And then utilizing home oral ketamine as a maintenance tool works really well as a maintenance measure so that the individuals can maintain that neuroplastic effect that they got from the initial infusions. Now, the issue of dosing oral ketamine is that it's based on clinical efficacy. It's just really a range-based trial that you kind of estimate. And unlike IV ketamine, where you know it's going to be 0.5 milligrams per kilogram initially, with oral ketamine, there isn't a specific number that you look at. You figure that if only 20% is absorbed, about maybe 4 or 5 times the initial IV dose of ketamine may be what you need to get started. But some individuals absorb oral ketamine extremely well. And so a dose that's extremely high, 300 milligrams or 200 milligrams under the tongue may really dissociate them. So a lot of times it's a lot better for an individual to start at a smaller dose, like 100 milligrams, to get comfortable with that at an initial dosing. Now, the other problem with oral ketamine is it can take several weeks for it to obtain its full effect. And oral ketamine has been used in a number of different mood disorders, including anxiety disorders, depression, and chronic suicidality. But it also could be used to augment traditional antidepressants as well. And there's a study demonstrating oral ketamine to augment the effectiveness of sertraline or Zoloft. And we've just mentioned about ketamine producing anxious reactions as well. And so adding some other tools to the toolbox, such as midazolam periodically, to the ketamine can allow the person to have more relaxation, induce better sleep, and kind of quiet down, the individual's sense of anxiety, at least periodically, using these midazolam-ketamine-ondansetron type melts. Now, IV ketamine is strongly supported by the evidence for its robustness and its rapid antidepressant effects. And we have a number of studies that listed over on the right, kind of reviewing larger studies. And this one here, a systematic review by Mark Conti's group, and covers a 10-year period of time, and they demonstrate multiple infusions resulting in enhanced and prolonged ketamine effect. And so certainly frequent infusions can actually enhance the results of ketamine infusions. We also have Shroma and Onrot, which also demonstrated the safety and effectiveness of serial intravenous subanesthetic ketamine IV doses in treatment-resistant depression. And this is what a room looks like at Nova Health Recovery for a ketamine infusion. And the individual is brought into the room and monitored. They are also, an IV is started generally with a small, tiny IV gauge catheter. The individual sits in a relaxed chair, kind of like a lazy boy chair, where they're monitored, and then the infusion is initiated. We also provide audio, sound. Some individuals bring their own headsets, as well as galaxy lamp lighting in a low light setting, so that the individuals can kind of have their own inward journey. And it's a completely comfortable, an amazing type of a journey for individuals. And of course, the end result is neuroplasticity and improved mental health. Now, there's also other types of treatments, one of which is FDA approved, which is Spravato. And the evidence shows from a meta-analysis from Bahi and his group that basically IV ketamine produces larger response and remission rates than Spravato. So IV ketamine produces a 3-fold greater response rate relative to Spravato and a 3.7 versus 1.47 fold remission rate. So there's almost a 3-fold difference in remission as well with IV ketamine versus Spravato. Likewise, there's fewer dropouts using IV ketamine, interestingly enough. So ketamine infusions are rapid and effective in treating depression, but we have to maintain these results. Now, we know major depressive disorder is one of the leading causes of burden of disease worldwide, and that 1/3 of patients with depression do not achieve adequate response with current treatment options. And so using IV ketamine, we can basically reduce rapidly and robustly these depressive symptoms. But unfortunately, the effects can be short-lived, and they might last only a few weeks. And it's been found that maintenance ketamine therapy is important, and it's one of the few ways to maintain IV ketamine effects. Now, psychotherapy can also augment and prolong the effectiveness of ketamine, but also lifestyle changes, integrative treatment options, as well as other medication support can be really helpful and critical to effective treatment. Now, here's just a listing of some other studies demonstrating that single and repeated ketamine infusions treat a number of mood disorders such as suicidality and bipolar depression and standard unipolar depression, suicidal thoughts and major depression, and of course serial ketamine infusions for suicidal ideation. And so each of these studies and randomized controlled trials and secondary analyses demonstrate the effectiveness of ketamine in an IV formulation in treatment of these multiple mood disorders. Now you have to ask yourself what your goals are. Is it symptom reduction or remission? And I think everybody wants remission. You just don't want to have the experience of depression. Now the question is, can home oral ketamine therapy really work? And what is the evidence? Now, there's a couple of randomized controlled trials out there demonstrating that oral ketamine can certainly be effective in some scenarios. Now, these are smaller, short-term trials, but in this particular trial, which is Jeff Farina's group, he utilized a 6-week randomized controlled trial of oral ketamine in patients with depression and chronic pain. And the placebo group was taking diclofenac, which is like a naproxen type drug and doesn't really have any psychedelic effects. But they took 46 patients and gave some of them 50 milligrams of ketamine 3 times a day versus diclofenac, the nonsteroidal, 50 milligrams 3 times a day for 6 weeks. And then they followed the individuals to the endpoint of antidepressant response and found that 60% of patients given ketamine had remission versus 15% given the diclofenac. And 45% of the individuals, and I got this backwards, 60% of the individuals had response with ketamine versus 15% with diclofenac. And then the remission rate was 45% with the ketamine versus 10% in the diclofenac group. So there was, a clear difference between ketamine versus a placebo. And this was a safe and effective treatment. There were no real side effects in this particular bunch. Now, it was also found that oral ketamine can accelerate response to standard treatments for major depressive disorder. And in this particular study, which is our Bazadeh's group in 2018, they took 90 patients, and over 6 weeks, they gave them oral ketamine, 25 milligrams twice a day versus placebo. And both groups got sertraline, which is Zoloft, at 150 milligrams a day. And they noted that antidepressant effects were noted within week 2 in the patient group that got ketamine. And that by the time 6 weeks came around, that there was an 85% response rate with ketamine versus a 58% response rate with placebo. And remission rates, however, were not different. So those were, the one thing was that remission did not really occur, but response did. And then there's another trial using oral ketamine in treatment-resistant depression with Domani's group. And on this next slide here, they utilized a milligram per kilogram of oral ketamine versus placebo 3 times a day, and they 3 times per week for 21 days. And they followed the Montgomery-Åsberg Depression Rating Scale. And they noted that it dropped in the ketamine group versus the placebo group, and that the response was 32% in the ketamine group versus only 6% in the placebo group. And remission actually did occur in the oral ketamine group, and it was like 27%. There was no remission in the placebo group at all. So repeat oral ketamine dosing actually produced a persistent amelioration of depressive symptoms in patients with treatment-resistant depression. There were some dropouts in this group just due to certain side effects. The other point to note with oral ketamine is that it takes longer for its antidepressant effect to occur. And in one series of reviews here by Rosenblatt's group using some 13 published articles, they found that the randomized controlled trials using oral ketamine showed an antidepressant effect that was good and tolerable, but it took 2 to 6 weeks to really get that effect. And the dosing of oral ketamine use was anywhere from 0.5 to 7 milligrams per kilogram, anywhere from 3 times daily to once monthly. So the trials are all over the place with the dosing that they use and the frequency with which they use it. But either way, the side effect profile is extremely small. And some people do benefit from oral ketamine. Another trial more recently by Hassan and his group demonstrated that sublingual ketamine for depression and anxiety using a retrospective, meaning looking back at their patient groups, demonstrated safety, effectiveness, and tolerability of home ketamine therapies. Now, a lot of times, this type of treatment, it's hard to say what dose the person should get. So if you're just doing a telemedicine provider with some of these more, I guess you want to say, PR type firms that are advertising and have large volumes of patients, it's going to be hard to really adjust and titrate your dose. So in this particular trial, they used a higher dose right off the bat. And so they had a large percentage of dropout rates. And a lot of these people probably couldn't finish the trial because of just side effects. But that said, this particular study did demonstrate tolerability and effectiveness in those that were able to continue through. And so they took like 3,300 patients that they screened. About 1,100 effectively were able to be evaluated. And in this particular situation, they found that there was a reduction of symptoms, but there wasn't any remission. Now, we know that from prior studies that especially with McMullen's group in 2021, reviewing a number of different articles, some 454 articles, that only repeated IV ketamine infusions can prolong the effectiveness of ketamine. Now, I do discuss in another video that also psychotherapy can be used to prolong ketamine therapy effect as well. So psychotherapy is an integral role in any type of mental health treatment. Now, how long can you stay on ketamine therapy? Really, there's not any known end date. There are patients that have been on it for many, many years for both mood and for pain. But in this particular study with Wilkinson's group in 2018, they looked at the outcomes of patients who were on ketamine for over 126 weeks using some 518 infusions, some 54 patients with a number of different mood disorders. And they demonstrated that the patients tolerated the ketamine infusions over that time well. Response and remission rates in their series was a little bit lower, probably because of the type of patients they were looking at, and that basically there were no long-term adverse effects in their sample. And we know from basically a study with Feifel's group in 2020 that repeated administration of IV ketamine for depression was safe, that effectively there was very few individuals who had adverse effects, some 0.7% of the individuals in this overall look, looking at some 69 providers and a few thousand patients, some 6,600 patients, that there was only a small percentage, 0.03%, that complained of cognitive decline, and that there was only 0.1% that complained of any bladder dysfunction, which is extremely rare. And of course, addiction, was virtually not seen. So again, ketamine therapies are extremely safe when given over time in a medically validated setting. We also know ketamine therapy can be pro-cognitive. And in this study with Marquez's group in a systematic review, they demonstrated that ketamine therapy for treatment-resistant depression, it's associated with cognitive improvement. And it's probably related to a decrease in depressive symptoms. So there's no apparent deleterious neurocognitive effects in short or long term in individuals with treatment-resistant depression using IV ketamine therapies. And there is also an antidepressant, mood stabilizing, and pro-cognitive effect using very low dose sublingual ketamine in both unipolar and bipolar depression based on an evaluation by Lara and her group. And they took 10 milligram dosings of very low sublingual ketamine, and they would do this every 2 to 3 days or weekly. These were outpatients with unipolar and bipolar depression. And they noted that there was a response and even some remission in individuals who went through this particular treatment, and that it was actually pro-cognitive. They actually had improved cognition. Now, ketamine also is effective in suicidality, and low-dose oral ketamine can also be utilized in chronic suicidality. And there are studies demonstrating efficacy in this one study by Can, and it was an open-label pilot study. And it did demonstrate that in 32 individuals that there was a 50% improvement in 10 weeks by the utilization of oral ketamine over that period of time in individuals with chronic suicidality. And Grande herself also looked at sublingual ketamine for rapid relief of suicidal ideation. And then also the question of sublingual ketamine is it safe and effective for anxiety and depression? And an open label effectiveness trial in Hull and his group in 2022 did demonstrate the same thing as well, where basically 1,247 individuals completed the treatment and 62% had a 50% or greater improvement in depression, and 63% improved in their anxiety scoring systems. But again, remission wasn't something that was really noted. But again, certainly remission is a great thing to have, but people just want to also feel better. And this did demonstrate the improvement of these individuals and the safety as well of home-based ketamine. More recently in November, a larger overview of the maintenance of antidepressant effects using ketamine therapies over time was also demonstrated to basically be safe and effective. This systematic review of efficacy, safety, and tolerability by Smith, Appledorn, and his group demonstrated basically that effectively IV, oral, and intranasal ketamine are safe and effective in the long run and can be utilized for the maintenance of individuals after IV ketamine infusions. And in this particular review, they mentioned that the safety of maintenance treatment were found in Feifel's group, which we mentioned earlier, and they evaluated some 6,600 patients who received IV parenteral ketamine for depression. And there were very few people that had to stop the treatment. Basically, some people had some nausea, but minimal number of people had any type of significant side effects, and all of them were reversed after the individual stopped the treatment. But there were no evidence of discontinuation due to addiction or cognitive deficits. As far as safety, again, these systematic reviews and overviews as well seem to demonstrate, again, the effectiveness of home-based treatment, the safety of them as well. So the conclusion of this particular systematic review with Smith Appledorn's group, again, to sum it all up, is that there is a therapeutic potential of maintenance ketamine treatment. The available data show sustained efficacy in the majority of initial responders, while severe adverse events seem uncommon. Use of maintenance ketamine treatment could be considered analogous to maintenance electroconvulsive therapy, which is ECT or shock therapy, for which there are no clear clinical guidelines. So, as a summary of oral ketamine and also MKO type melts that are compounded, using oral ketamine alone certainly can provide relief, but unlikely to provide remission. But in some individuals, it certainly can. Now, oral ketamine probably is best utilized as maintenance therapy after ketamine infusion therapy. And that's what we've seen at Nova Health Recovery is after individuals complete their IV ketamine, we use a combination of nasal spray ketamine as well as oral ketamine. Usually the individuals would do the oral treatments once or twice per week. These will be maybe 100 or 200 milligram ready to dissolve tablets. They'll dissolve them under their tongue, leave them there for about 10 minutes and just kind of relax and do some sort of self-maintenance, whether it's some sort of meditation or something along that lines, and kind of take some time out for themselves. And that this has been very effective in the maintenance of antidepressant effects. And that there's very few side effects that have been noted in any of the trials using home-based therapy. And we find the same thing as well at Nova Health Recovery. Certainly use, misuse, and addiction potential can always occur for anything, but it's very small. It's a very small percentage, and it can be monitored. We know that bladder issues are extremely low, especially at the dosing that's being used for this type of treatment. So low doses as used for antidepressant effect are relatively safe. Actually, they're really safe relative to antidepressants, and antidepressants do have a fair amount of problems themselves, both from weight gain, anhedonia, which is the lack of pleasure, and emotional numbing, as well as the sexual side effects. All those things are not side effects of ketamine therapy. And there are very few randomized controlled trials for oral ketamine therapy used as maintenance, but they do demonstrate efficacy. And so the dosing really is what it comes down to. And, just giving a single dose or a second dose, from some central provider doesn't really allow the titration that individuals need in their follow-up for ketamine therapies. It's really going to be a personalized treatment. It's based on the person's outcomes, not based on their journey. So the one thing is that everybody's kind of projecting onto ketamine that the journey is what everything that ketamine is all about. And that's just MDMA type treatment and psilocybin treatments being projected onto ketamine therapies. And certainly a pleasant journey and a journey itself can be really helpful for individuals. But this is really about neuroplasticity and then follow through integration with your therapist. So that said, the options available for follow-up ketamine certainly could be oral ketamine, it could be intranasal ketamine, and of course periodic ketamine infusions. And I just want to put out there one more time that periodically individuals will have excess anxiety and insomnia. And so in those individuals, using midazolam-ketamine-ondansetron melts at bedtime as a periodic option can be a real great option to treat periodic insomnia and anxiety.